A labor epidural is an analgesic technique where medication is administered to the epidural space through a catheter inserted in the lower back. This reduces contraction-induced pain by blocking the pain-transmitting nerves. About 90% of the labor patients seen in communities' labor and delivery facilities are benefiting from an epidural. Once you are admitted and confirmed in labor, and you and your obstetrician agree you are ready for an epidural, your nurse will consult an anesthetist. Research has shown that epidurals do not prolong labor or increase the risk of cesarean section or forceps delivery.
Looks like you're having a little bit more pain than before. How are you doing?
They're definitely getting a lot stronger now. I think I might be ready for my epidural.
Okay, let me give the anesthetist a call.
Okay.
While you may receive an epidural at any point during labor, it's usually best to wait until you're dilated to at least 3 to 4 centimeters to make sure the epidural continues to work well throughout labor and during delivery when the pain is most intense. If not already completed, the nurse will start an IV and order some laboratory work. The entire process may take anywhere from half an hour to an hour before you feel relief. So it is important to plan accordingly. Just as getting an epidural too early is not ideal, asking for an epidural too late may not leave enough time to place the epidural and get relief before your baby is born. Once the initial preparation is complete, the labor nurse will call the anesthetist. Monitors will also be placed to monitor your blood pressure and heart rate. You will be assisted to sitting on the edge of the bed.
Hi there.
Hi.
My name is Greg. I'm your nurse anesthetist. I understand you'd like an epidural.
Yes.
How much do you know about an epidural?
I don't know very much, just what I've read online and what my friends have told me.
Okay, well, the first thing you should know is epidurals are generally very safe. There are a few risks that are very rare, like bleeding, infection, nerve injury, that could simply happen because we're going to be placing a needle in your skin just like we might an IV. As far as infection is concerned, the risks are minimized because we use a disinfectant to clean your skin. And there's a risk for nerve injury, but that is very rare because we place the epidural at a place that's below where the spinal cord ends. The most common problem we see is a special type of headache called a spinal headache. That usually occurs within 24 hours after we place the epidural. It's something that we have a way to fix if we need to, but in most cases it goes away on its own. Occasionally the epidural may not be working as well as we'd like or as well as you would like. There is an anesthetist in the hospital 24 hours a day, so if at any time you're having any problems, make sure you have the nurse give us a call and we'll come and see what we can do to make that better for you. Okay? Do you have any other questions for me?
Does the medication affect the baby?
That's a really good question. There's only a small amount of medicine that actually gets into your bloodstream so that it might affect the baby. However, when we place an epidural, the epidural will cause your blood pressure to drop. That blood pressure drop could affect both you and the baby. So if you're having any problems, make sure you let us know, like nausea or vomiting. And then we can give you IV fluids or medicine to get your blood pressure back into that normal range. Any other questions?
I don't think so.
Okay, let's get started.
Proper positioning is one of the most important parts of getting an epidural quickly and efficiently. The better the positioning, the quicker and easier it will be to place the epidural. The anesthetist and nurse will guide you into the proper positioning. You're going to try to make sure your hips are even, try to hold still, and slouch your shoulders and round your back.
All right, that positioning looks pretty good. When we're doing this, I want you to just keep your shoulders relaxed and keep yourself rolled over your baby there, okay? I will be telling you every step of the way as we do this, so there won't be any surprises along the way. The first thing we'll do here in a second is wash off your back with some cold soap. I will do that 3 times. It'll be cold and scratchy. And then we'll put a drape up on your back, okay?
Okay.
If you have a contraction at any point, just let me know, okay?
Okay.
And we'll try to pause if we can. All right, so here comes that cold and scratchy part. Remember, it's cold and scratchy, and I'll do that 3 times. Number 2. And last one. The next thing we're going to do is put a little drape on your back. Feel cool plastic drape here. It takes me just a second to get a couple more things ready here. All right, the next part is going to be the part that hurts. You might feel a poke and a burn. It should last for just a few seconds here. All right, now feel where I'm pushing on you here?
Yes.
I want you to push that lower part of your back out to me and roll over your patient. Amber, could you help her? Thank you. All right, you're poking a burn here. Is that okay?
That wasn't that bad.
Okay.
I think I'm gonna have a contraction though.
All right, we'll just wait here for a second.
Although it usually only takes a few minutes to place the epidural, finding the right spot can take longer, depending on the individual patient's anatomy and size.
Okay, go ahead.
All right, now you're going to feel some pressure. It should feel like it's in the middle of your back. If it doesn't feel like it's in the middle or anything hurts, let me know.
Okay.
This part should take about 2 minutes. All right, actually we're in that spot. I'm going to just thread that catheter. All right, the catheter's in. Needle is out. We're just going to tape this down. And then I'm going to pull off this drape, okay?
Okay.
The next thing I'm going to do is put a little test medicine into the catheter. If you feel any strange sensations like funny taste in your mouth, ringing in your ears, feel like your heart's racing, or your legs are getting numb, let me know, okay?
Okay.
How's that feel?
It just feels like cold pressure.
Alright, then we're just going to put a couple more dressings on here and we'll pull down that drape.
It feels like another contraction is coming.
That's okay, just try and relax and breathe deep. You don't actually have to hold still for this part, just try not to reach back yet, okay?
Okay.
Alright, once that contraction is done, we're going to lay you down on the bed.
It's done. I didn't feel it as much.
Alright. We're going to lay you down here.
Once the epidural location is verified and you're laying back in the bed, the anesthetist will give an additional dose of medication to get you comfortable. Roughly 5 to 10 minutes after this dose of medication, you'll feel your legs getting warm and tingly. When this happens, you'll feel your contractions getting shorter and less intense. It is normal with a working epidural to still feel pressure when having contractions. The epidural catheter is very flexible. You do not need to worry about it. Lying on it or moving around it is not going to affect it in any way. The anesthetist will connect the catheter to a pump that administers a continuous dose of medication throughout the duration of your labor and delivery. You may also have a button that will give you additional medicine if you push it. You cannot overdose yourself by using the button. Please let the nurse know if you're going to use it. It is normal to need to use the button as the baby starts to move down further into the pelvis. For that reason, we have some more medication you can give to yourself. You should have the nurse call the anesthetist if you're not getting comfortable. In the unusual case that the epidural continues to not work well, it may need to be replaced. Proper positioning in bed after epidural replacement is also important to make sure the medication is distributed evenly to both sides. You will have to remain in bed after receiving your epidural, as your legs may be weak and you will be at high risk for falling. You will not be allowed to eat anything other than ice chips or a popsicle until the epidural catheter is removed. Once you're comfortable, the labor nurse will periodically place a urinary catheter to drain your bladder, as you will not be able to get up to go to the bathroom. If for any reason during your labor you need a cesarean section, the epidural may be used if it is working well. If not, it will be removed, and another regional or general anesthetic technique will be used instead for the surgery. If you are on either of the medicines methadone or Subutex, you will still be able to get an epidural without any major modification to your care.